Yes, good morning. My name is Krish Gundu. I'm the co-founder and executive director of Texas Jail Project. We're a small statewide nonprofit advocacy group working on the intersection of jails and the public health system. We help families navigate the often complex and always confounding criminal legal system when their loved ones are criminalized for their mental illness and or IDD. In our work, the pattern of practice that we have documented is that many a time families of people with IDD have not been provided all the care options, which include SSLCs. They often hear about an SSLC from us after their loved one has been arrested from a group home or the community and has been incarcerated in a county jail. We have not had a single IDD case in the past 5 years where the person's behavior did not warrant a higher level of care, such as an SSLC, but none of those individuals were ever informed about an SSLC or placed on the inpatient care wait list. And the reason I mentioned that is because it seems like from your long-range planning report, the draft, that there is not enough demand for SSLC beds, but it seems like if people didn't know about the existence of SSLCs, then there would not be demand, but they're not being informed about it. So it just seems a little confusing the way it's being presented, that there isn't demand. And then if you look at the data that HHSC presented at the IDD Advisory Committee that's run by the Texas Commission on Jail Standards, which is a legislatively mandated committee, that data showed that the largest number of transfers of people with IDD to SSLCs are happening from county jails. We should all be so shocked and ashamed by that data. And of course, the second largest referrals of people to SSLCs are happening from group homes. But the first is county jails. So that tells us that we are waiting for a crime and, God forbid, a victim before providing what is already an entitlement for this population. So to claim that the demand for SSLCs is shrinking is frankly confounding, given how many people with IDD are making their way into SSLCs through the forensic pathway. We would strongly urge HHSC to not only recommend an expansion of SSLC beds, but also expand the criteria so that people are not criminalized for their behaviors. We should be turning them into centers of excellence where the next generation of workforce can be trained. I want to leave you with a message from a mother who could not be here today. She works 2 jobs to take care of her other kids, but her teenage son spent 7 months in jail after being arrested from a group home before making his way to an SSLC. He's been there for over a year now. She told me yesterday, she called me to tell me specifically that I must include this in my comment. SSLCs provide an extremely high level of exceptional care and services, care that many families depend on and cannot find elsewhere. For some individuals, these centers are not optional, they are a necessity. My son is in a safe, structured environment where his needs are being met. He has friends, participates in activities, and benefits from stability and structure that would be difficult to replicate in the community. I strongly support continued investment to modernize facilities and ensure residents receive the care that reflects their dignity, safety, and respect. And then she said, for the first time in over 2 years, he told me, "Mom, I love you." I never thought I would hear that ever again because her son is mostly nonverbal. So that's the level of improvement he's made with the attention and the care that he's been getting at SSLCs. Again, I urge HHSC to really think about including expansion of beds and expansion of criteria. And we need to change this narrative that the largest number of transfers to SSLCs are happening from county jails. Thank you so much for your time, and thank you for listening.
Thank you for your testimony, Ms.